evening, everyone. My name is Eric Guo, and I'll be telling you about stem cell therapy, the future of personalized medicine. So the conventional way of treating medicine is to use small molecule drugs. An alternative way of treating diseases are actually using cells themselves. So these so-called cell-based therapies will be the focus of this last section. So everyone hears about stem cell in the media all the time. And in fact, the use of stem cells to treat diseases are not something totally novel. You might have heard about bone marrow transplant. In fact, the active ingredient in bone marrow transplant are the stem cells. These bone marrow stem cells, upon transplantation to the patients, gave rise to blood cells to replace the damaged ones in patients, for example, with leukemia. So first of all, what is a stem cell? Well, stem cells have two unique properties that make them differ from other cell types in your body. So first, they are able to replicate themselves, a process known as self-renewal. Second, the stem cells can give rise to many more specialized cell types, and this property is known as differentiation. For example, when we say that a stem cell can differentiate into a neuron or a red blood cell. So because of these two unique properties, many people have given a hope using stem cells as a treatment for many human diseases. So there are three types of stem cells. There are embryonic stem cells, or ES cells for short. These are cells derived from the early embryo, and in normal development, stem cells in the embryo can differentiate and become adult stem cells, which then give rise to more specialized cell types. So embryonic stem cells has one unique property known as pluripotency, which is the ability to give rise to all possible cell types in adult animals. Unlike embryonic stem cells, adult stem cells are a little bit more specialized, and they can give rise to only a limited set of specialized cells. For example, blood stem cells can give rise to all blood cells, such as red blood cells and white blood cells, but they are unable to differentiate and become muscle cells. Very recently, the third types of stem cells have been discovered. These are known as induced pluripotent stem cells, or iPS cells. These iPS cells can be derived from many types of specialized cells through a process known as reprogramming. So these iPS cells are similar to embryonic stem cells in terms of their ability to give rise to all possible cell types. And it is a discovery of these iPS cells that has changed our view on treating diseases, because they're able to provide patient-specific cells for customized tissue repair and cell-based therapies. So I would like to give you an example using each cell type treating diseases. So I'll start with the use of adult stem cells in a case study of corneal regeneration. So a group of doctors in Italy are interested in a particular kind of blindness. So these patients accidentally spill chemicals in one of their eyes, such as acid and alkaline. These harsh chemicals damage the cornea of their eye and causing blindness, because other cells in the surrounding tissue start to grow and invade into the cornea, causing blindness. So what these doctors did then is they took a biopsy from patient's other eye, the healthy eye, and then grow these cells in culture. And this process is also called tissue culture. So basically, one can take cells from animals and human and grow them into this little plastic dish containing liquid media, which has all the nutrients necessary for growth and metabolism. So in this way, they were able to expand these eye cells and then select for stem cells. And then transplant these healthy stem cells back into the blind eye a few months to a year after treatment. In about 80% of the patients receive the treatment, you see permanent restoration of the vision. Well, this has been very successful, and they've cured over 100. They've tested this. They've performed this treatment on over 100 patients, and these treated eyes are actually very stable over time. These patients have been followed up for at least 10 years after receiving this treatment. And similar approaches have also been used on patients with severe skin burns and has also been very successful. But despite all this, there are limitations using adult stem cells to treat diseases. These cells are in general, these cells are very difficult to get to large enough quantities for treatments. And one cannot use cells from other tissue because adult stem cells has limited potency. And lastly, in order for this to work, one has to rely on the presence of healthy stem cells in the patient. The previous example won't work if both of the patient's eyes are damaged by the chemical. So because of this, many people have given a lot of hope on human embryonic stem cells. So human embryonic stem cells are derived from the early embryo, and at a particular stage of the early embryo development, it's called the blastocyst. Cells inside the blastocyst have been isolated and grow in culture and became embryonic stem cells. Because they're derived from the early embryo, which is able to give rise to adult animals, these embryonic stem cells are capable to give rise to all possible cell types that one can find in adult animals. Because of this unique ability, many people have the idea of using human embryonic stem cells to treat diseases. To treat diseases in an individualized way, because one can imagine you can differentiate the stem cells into a particular cell type or tissue depending on the disease a particular patient has, and then transplant these healthy cells back into a patient to cure the disease. So this idea has been around for a long time now, over a decade, and has been tested in animals. And these early work are very successful, and these led to the involvement of several biotech companies trying to develop human embryonic stem cell therapy for various human diseases. So currently, several of these products have been approved by FDA and undergoing clinical trials. So to give you an idea of how this might work, I would like to focus on this last treatment developed by a company named Biosite, targeting human disease of type 1 diabetes. So about 6% of the US population currently carry type 1 diabetes. As the population becomes more and more obese, that number will increase. So in our pancreas, there are these specialized cells called beta cells, colored in purple in this cartoon. These beta cells are able to produce insulin in response to sugar levels in your blood. So after a meal, the sugar level in your blood will increase. And these beta cells, in response, will produce insulin, which is a hormone can travel in your bloodstream, acts primarily on muscle cells and liver cells, sending a signal to these cells to take up sugar from our blood, thus maintain a relatively stable blood sugar level. In patients with type 1 diabetes, their own immune system recognize beta cells as foreign pathogens and develop antibodies to attack these cells and kill them. So these patients are unable to maintain their own blood sugar levels. So the current treatment for type 1 diabetes is by insulin injection. So these patients have to inject themselves insulin before each meal. And they have to do this. They have to do this for their entire lifetime. As you can imagine, this is very painful and very expensive. And in fact, type 1 diabetes is a disease which can be better cured using cell-based therapies. So scientists in Biosite has successfully used human embryonic stem cells to treat a mouse model with type 1 diabetes. A mouse model is basically a mouse which carry a similar disease as in a human patient. So cause and symptom of the disease in a mouse are very similar to the ones in human patients. And mouse models have often been used to basically reduce the risk of testing premature treatments on humans, basically to reduce risk in us. So what they did is that they took human embryonic stem cells and differentiated them into pancreatic stem cells. And they've shown that these cells are able to give rise to insulin-producing cells, like the beta cells. So they've done transplant. One thing I should mention about mouse model is that mouse and human are similar enough, oftentimes one can transplant human cells in mice, and these cells can grow and can grow normally. So taking advantage of that fact, they then transplant these human cells in mice and let them develop and mature for about 3 months. They then treat the mice with a special drug that specifically kills the mouse insulin-producing cells, but not the human cells. So after the drug treatment, the mouse are unable to produce insulin from their own cells. But because of the presence of these human cells, they're able to produce insulin and maintain a relatively stable level of their blood sugar. So these prove that this cell-based treatment can be used to cure type 1 diabetes. So currently, this treatment is undergoing clinical trials. And it'll be very interesting to see the outcome of this particular treatment. However, human embryonic stem cells do not exist in adult patients. Thus, one has to use cells from a foreign source. And this, of course, causes the problem of immune rejection. So after receiving the transplant of human embryonic stem cells, patients have to be on immunosuppression treatment after, basically for the rest of their life. And despite all this, there is ethical debate about whether we should study human embryonic stem cell at all. So then the question is, are there human cells which have properties similar to the human embryonic stem cells, but are not derived from the embryo? Well, fortunately, the answer is yes.